I'm Dr. PK from Dr. PK Life, and this video is about myelodysplastic syndrome. Myelodysplastic syndrome is a bone marrow disorder in which the marrow does not produce healthy, mature blood cells properly. Instead of making normal red blood cells, white cells, and platelets, the bone marrow produces abnormal, which is dysplastic cells that often die prematurely. As a result, patients develop low blood counts. What normally happens, your bone marrow acts like a factory that produces red blood cells which carry oxygen, white blood cells that fight infection, and platelets that help stop bleeding. In MDS, this factory becomes inefficient and defective. Why is MDS important? Because it can cause anemia, which can cause fatigue, weakness, shortness of breath, low white count, that means recurrent infection, low platelets, like easy bruising, bleeding. And in some cases, MDS can progress to acute leukemia, especially acute myeloid leukemia. Who gets MDS? Most common in people over 60 years of age. Slightly more common in men, high risk, and people with the previous chemotherapy, radiation, exposure to chemicals like benzene, and prior bone marrow disorder. Symptoms depend on which line of marrow cells are affected. If red cells are affected more, it's going to have fatigue, pale skin, dizziness. If white cells are affected, you're going to have frequent infection. If platelets are affected, you're going to have bruising, bleeding gums, and nosebleeds. So many times all lines of cells are affected. So the symptoms depend upon which cells are majorly affected or not. How it is diagnosed? Diagnosis requires complete blood count, CBC, which shows low count of red blood cells, white cells, and platelets. Peripheral blood smear shows abnormal shapes of cells, and bone marrow biopsy confirms dysplasia. Genetic testing is done to find out chromosomal abnormalities. MDS is considered bone marrow cancer, but it behaves very differently from typical cancer. Some forms are very mild and stable for years. Others are aggressive and may transform into leukemia. Doctors use a scoring system to assess risk. And treatment options depends on the risk category and patient age. Low risk MDS, blood transfusion, erythropoietin injection, growth factors, sometimes iron chelation. High risk MDS, chemotherapy drugs, targeted therapy, bone marrow, stem cell transplant, potentially curative. So MDS is a disorder where the bone marrow fails to produce healthy blood cells effectively. It may present with fatigue, infection, bleeding. Early detection and proper risk assessment are crucial. Thank you for watching.